Do you feel pain when you urinate? Do you have a cloudy smelling urine? Do you see blood in your urine? Do you have penile discharge? Or do you have lower abdominal pain? Or do you suffer from nocturia, that's frequent urination at night? Then this video is for you. Hey guys, welcome to my YouTube channel. I am Nurse Obad Aderonke, and in this episode, I will be educating you more about urinary tract infection, UTI. So get your paper and your pen and let's learn together. Before we go into UTI, let's understand what UTI is. UTI is an infection along the entire urinary tract, and they are classified into two. We have the upper urinary tract infection and we have the lower urinary tract infection. The major example of the upper urinary tract infection is pyelonephritis, which is an inflammation that affects the renal pelvis and the parenchyma of the kidney. And the example of lower urinary tract infection is cystitis and urethritis. Cystitis is an inflammation and the infection of the bladder, while urethritis is an inflammation of the urethra. Do you understand that? So what are the predisposing factors and what can expose you to having UTI? Predisposing factor of UTI are sexual activity, short urethra in female, diabetes, catheterization, incomplete emptiness of the bladder. This happen mostly within female. When you want to pee, you feel like if you don't pee at once, it makes your pelvis tighter. That's not true. Just pee if you feel like peeing. You don't need to hold your urine because by doing so, you are exposing yourself to UTI. What is the cause of urinary tract infection? It's caused mainly by microorganisms, and we have different kind of microorganisms. We have Staphylococcus, we have Candida, and so on. The pathophysiology of UTI. Pathophysiology is how these microorganisms enter inside the body and destroy, and how they function in the body. So, I hope you are not being confused so far. The microorganism gain access to the urinary tract from the urethra to the bladder, causing a backflow to the ureter during urination. This microorganism enter from the bladder to the ureter and to the kidney pelvis, especially where there is stasis or incomplete emptiness of the bladder. This microorganism can multiply, which cause inflammation and can lead to some symptoms like burning sensation, painful urination, nocturia, that's frequent urination at night, smelly or cloudy urine, blood in urine, penile discomfort and penile discharge, fever, frequent urination. These are some symptoms that you feel when you are having UTI. How do they diagnose UTI? UTI is diagnosed by simply going for tests like doing a urinalysis, because urinalysis will reveal if you have pus, bacteria, or RBC in your blood. Elevated white blood cell count in pyelonephritis can also be a sign that you are having a UTI. Also, CT scan can be done to check if you are having any obstruction in your urinary tract. Urine culture can also be done. Possible blood tests can be done to know if you are having UTI. So what are the treatments for UTI? UTI is treated with antibiotic because it's a microorganism that causes it. Complications of UTI: renal failure, renal calculi, urinary retention, sepsis, and so on. UTI is not a funny thing. If you are having any of these symptoms, kindly go to the hospital for proper checkup and diagnosis. Don't do home treatment. This is the end of today's episode. I'm going to see you in my next episode. Don't forget the way we do it. If you have any topic you want me to talk about, drop your comments in the comment section, and don't also forget to hit the subscribe button, subscribe to my YouTube channel, like, and also comment, share with your friend. I will see you in my next episode. Bye.